Efficient use of face masks and the maintaining of at least 1 meter distance between one person and another is proving to be a challenge for some since the total lockdown was partially lifted. Based on the traffic of people, the measures have not been fully implemented because people are still so close to each other. The 1 meter distance between people is not possible because of the large number of people here in Nyabugogo. The market is very crowded. This face mask doesn't have good air porosity, so the air I breathe remains inside and it generates heat. That's why one pulls it down so that they breathe properly and then wears it back again. In addition to that, with people visiting each other in their homes, the situation is likely to increase infection cases dramatically. Close observers of the COVID-19 pandemic find this alarming. It is worrying because if I come to your house and we come into close proximity, that's how you will hear people got infected from homes. We are not yet at a place where we can visit each other. We are still in the period of illness because COVID-19 is present. There are patients in the hospital. There are some who may still be in the unknown population. Failure to practice social distancing might push us a step backwards altogether. In addition, there are many people who don't properly wear the masks. For instance, some put them around the ear, others below the mouth. So if not properly followed, could even lead to other issues. And if not properly observed, it might take a long time to overcome and even cause death. With the World Health Organization saying that the best way to deal with the COVID-19 pandemic is to test as many people as possible, Rwanda Biomedical Center says the country already has enough capacity to test for this pandemic. RBC's Director General Dr. Nsanzimana Sabei says that in the coming days there'll be conventional HIV testing machines that will be used for coronavirus testing. We've been testing more than 1,000 people for a week, and we want to exceed that number. We are planning for other HIV testing machines to be used for coronavirus testing in different provinces. That too is going to be soon. The ones in the lab we started with have also multiplied, but even those who need to be tested are increasing day by day. The capacity of the laboratory doesn't come at once. Every day we add something new. Either equipment-wise, the capacity of the people that test, as well as extending the testing facilities to the people instead of relying on the national laboratory only. This is in addition to the preparation of other centers that will support the ones at Kanyinya and Nyamata to receive COVID-19 patients should the numbers increase significantly. The more people go out to their different jobs, the more the risk of getting sick increases. So if it increases without a place to facilitate, it would be a challenge. That is why we have a follow-up team that looks at those numbers and says, let's plan here and there and we'll open another site. Or if the numbers reduce, we will close it. We had 2 treatment centers and there's still space to treat more patients, but there's also a team that is preparing for the 3rd and 4th when the need arises. The number of people infected with the pandemic in Rwanda is not a concern compared to some other countries affected by the pandemic, as the percentage of people infected in Rwanda is less than 1%. As of Tuesday, 36,000 people had been tested in Rwanda, and more than 260 people have tested positive to this virus.